In your box from the pharmacy, you're going to get two different types of HCG. One of which is the HCG trigger. It might say Pregnel, Novarel, or generic HCG, and it's going to say 10,000 units per milliliter. This has two different vials. Please do not mix them until the prescribed time. And the second kind you're going to get is HCG mini or micro or low dose, and the key is that it says 100 units per milliliter. It comes in a little medicine bottle with a vial inside. It's a multi-dose vial that should get you through most of the cycle. We're going to use this vial as an example. Whenever you're getting ready for your injection, you want a clean, dry surface, and you want to make sure you wash your hands. All of these injections are given into the lower tummy, about an inch or two away from the belly button and below, and you pinch up a piece of fat and inject at a 90-degree angle. You're going to make sure to clean the top of the vial with an alcohol swab and clean your skin in a circular motion. And then you want to draw down to your dose in air. The usual dose is 20, but not all the time. You want to make sure that the top of the black plunger lines up with the 20 mark. You're going to put air in before drawing medication out because it is vacuum pressured. Pull the cap straight off and put it into the gray part of the plunger. Inject in 20 units of air. Flip it upside down so that the tip of the needle is submerged in fluid, and draw down to your dose. Sometimes people get bubbles in these. Bubbles are not necessarily a problem, but we just don't want them to displace the medication so you get the right dose. You can try to flick it out while you're holding it, but that doesn't always work. Sometimes I just push it all the way back in and pull down slowly. Or sometimes I go a little bit past the mark, pull it out. It's easier to flick when it's outside the vial. Kind of squirt it up to my dose, and then you're ready to give it. Get ready to pinch the skin. Go in at a 90-degree angle. Bring your finger to the plunger. Push in, release, and pull out. So another thing about the HCG trigger is that it doesn't need to be refrigerated until mixed, so you can just set this one aside and we'll pull it out towards the end of the cycle. The mini HCG does need to remain refrigerated, and you'll be using it daily.